Welcome to Perspectives, a special presentation of the Power of the Patient Project. Today's guests are Bob Kieserman and Christina Richmond. And now, here is your host, Charlotte Grinnell.
Hi, I'm Charlotte Grinnell, and welcome to Perspectives presented by the Power of the Patient Project. Our session today is called The Patient Experience Right Now, from the perspective of the patient and the provider. My guests today are Bob Kieserman and Christina Richmond. Bob Kieserman is the Volunteer Executive Director of the Power of the Patient Project. Now retired, Bob spent over 35 years as a professor of healthcare administration and a healthcare consultant. For over 20 years, he was the program director of the Healthcare Administration program at the Arcadia University School of Global Business near Philadelphia. He is the author of 4 books and hundreds of articles on medical practice management and the patient-provider experience. Christina Richmond, MPH, is the Director of Operations for Cardiology Consultants of Philadelphia, the largest independently owned physician practice in the United States. She joined CCP in 2013 as a practice manager and has grown with the organization over the past 7 years. Professionally, Christina has also worked in the non-profit research sector and taught healthcare process improvement as an adjunct professor. Christina is a graduate of Arcadia University's Health Administration program and Drexel University's School of Public Health Master's Degree program. Bob will be focusing on the patient perspective, and Christina will be focusing on the perspective of the provider. As a host of this series, I'll be asking the questions and allowing my 2 guests to have a dialogue about some important issues right now. So welcome, Bob and Christina. I'm so excited to start this with you guys.
Thank you.
So Christina, it must be tough right now being a healthcare provider. And Bob, it must be really scary for patients who know that they need to see a doctor but are afraid to visit the office. So my first question is, Christina, how are doctors trying to accommodate their patients and make them more comfortable seeking care? And Bob, how are patients dealing with their legitimate concerns about going into the office?
I'll let Christina go first.
Yes, so thank you. The provider basically before March 17th, for lack of a better date, is kind of never had been telehealth. We kind of switched over almost immediately to providing telehealth services as best as possible in a world that it wasn't the norm. And so over the course of the last 10 months of this pandemic, we've really kind of focused in on how to provide telehealth while also being able to provide in-person diagnostic services. The unique thing about providers is that providers are also patients in their own personal lives, so they offer that unique perspective as well. They're able to see what they would want if they were a patient. And I see that a lot when we go into our offices, is to say, how would we want this if I were the patient? And how would I want this to be if I were sitting on the other side of the exam table or the other side of the desk? And a lot of what we do is screening patients before they come into the office. So before you even cross the threshold, making sure that we've completed COVID screenings to make sure that we have spaced people out in exam rooms or in waiting rooms, minimizing the use of a waiting room now and really utilizing exam rooms for those purposes. Cleaning procedures, utilizing technologies I didn't even realize were a thing before the pandemic, using fogger machines that you would buy at a Home Depot to sanitize the air, especially in diagnostic testing where you're running on treadmills or doing things that may spread particles. So I think that the main point here is that we've changed to even adapt from a cleaning perspective, but also keeping in mind throughout the entire experience that our providers are also patients, so bringing that unique perspective as well.
And from the patient's perspective, they're scared. And I can vouch for it. I mean, I'm a retired older gentleman, and I think that the other people of my age would share the same sentiment. We're scared to go to the doctor. We're scared of a few things. We're scared of being in the doctor's office. We're scared of being near the doctor. We're scared of being near the instruments, lying on the examination table. Um, we're fortunate that the doctors, most of them, are asking the pre-screening questions before we even come over the telephone. That gives us peace of mind that they're being proactive about this. I have been in offices, however, specifically a cardiologist's office, where they are a very busy practice, and you walked in and I was literally shocked because the waiting room was filled with people, social distanced, but nevertheless filled with people. On the other hand, my PCP calls us in from the car, which is a very common protocol today. And that gives me peace of mind that I'm really the only one who's in that office for my visit. And they scoot me into the examination room, so I'm not waiting for anything. But I think from the patient's perspective, we're wearing masks, we're wearing shields, we're wearing gloves. It's kind of funny that I had to go to an appointment in March or April when this whole thing started, and it was for an ENT. And the doctor had to say, you got to take off your mask so I can examine you. It didn't even dawn on me. I was so tense. So we're always on our guard. Mm-hmm. But I do agree with Christina. The doctors are doing everything they possibly can. Most of the doctors doing everything they possibly can to make us feel calmer than we come in. But it's a tense time for doctors, and it's a tense time for us, patients.
Yeah, I think we have to remember too that the provider doesn't want to get coronavirus any more than the patient does. And so everybody's taking those extra precautions, and everybody feels that risk. And you're right too, it's scary. It's scary to go to the doctor for some people before a global pandemic, right? But in a pandemic environment, it can be even more tense because you kind of look at everything in there, and it's all a vector for an infection, right? It's all a way for you to potentially get an infection. Every person in that room is a potential exposure for you. So making sure that you can, at least from a provider perspective, put that patient at ease as best as possible by doing these things like calling them in from their car and making, we've had patients who have kind of pushed back on some of our screening protocols, but at the end of the day, if you know that I'm screening you like this, then you know that the person who came in before you was also screened from that same perspective and is also going through those same protocols to be able to enter in the office to receive treatment.
Right, right.
Yeah, I think it's a really important perspective. Approach what you were saying about thinking about the providers as also patients. I think that's a very empathetic way of thinking about it. And I think sometimes I forget that providers are also patients and have to go into the doctor themselves as well. So that's really interesting to think about it that way.
And they all judge, right? They're all looking at everybody and saying, well, when I went to the pediatrician with my kids in the beginning of the pandemic, seeing how they did things allowed me to adapt practices for our operations and everybody feeding off of each other. And then certainly I've been to doctors too, where I'm like, what are you doing? Like, let me get back behind there and help fix this for you, because there's better ways to go about that. And I think it offers that balance between being both a patient and provider.
Right. And you both kind of touched on this in the last answer, but how do you think the patient experience overall has changed in the past 10 months?
I think from a patient's perspective, we're going to hopefully get into this later in the discussion, but one of my greatest concerns looking as an observer to this whole thing, and Christina probably will totally agree, I'm sure, is that doctors are going to miss a lot of important diagnoses because people are not coming in, especially cardiology, cancer types. People are reluctant to acknowledge the fact that they may have an issue. And I was not a great proponent of telemedicine until this happened. And now I see that there's an advantage to it. I did a video last week where I spoke about the fact that I was asked, do you see telemedicine remaining? after this is all said and done? And yes, because doctors can now have a visit with a patient and share information. They can talk. As long as they don't have to be examined physically, this works. But back to what I was saying, I'm concerned as a patient that a lot of people are afraid that they may have to be hospitalized, because we hear the stories that if you go into the hospital, you're going to be by yourself. You're not going to be able to be with anybody. No one's going to be able to visit you. But I think a lot of people are playing Russian roulette with their health. And that's how the patient experience, I think, has changed. People just not willing to consider the fact I have to go to see a doctor now. They may tell me that I have COVID, and then what am I going to do? So it's scary to me.
I agree. I think, if you had asked me the same question back in March, I would have, and I did. I said that telemedicine, it's not a long-term solution for us, but I don't necessarily agree that telemedicine will go away now. And I think that what we're going to see is a mixture of the two. And I think that there's a benefit to doing telemedicine, but there's always a benefit to that physical examination. And like Dr. Kieserman or Mr. Kieserman was saying, there is a balance there. There is the patient is afraid to come in because they might be told to go to the hospital. And we see that in cardiology a lot. A patient will call up and say, I'm having chest pain. And immediately when you say chest pain, our reaction is, I need you to go to the ER. And I've fought with patients to try to convince them to go to the ER and try to get them to go in. And when we do that, we also put at risk the idea that the patient may not call next time, because the patient doesn't want to hear that. What the patient wants to hear is, go lie down for an hour and you'll probably see some, they want to be comforted in that moment and not be scared further or be told to go to the hospital. And so when we talk about healthcare now, it's a big push in the spring and now a big push as we go into the winter for telemedicine, whereas we were kind of at the plateau of the pandemic able to bring people in more for these diagnostic tests. And I think that helped people, because what we were finding was patients who were going for their first telehealth visit, great. Second telehealth visit, it was like, well, okay, how much can you really glean from a conversation without a physical examination, and what kind of diagnostic tests? And as we're approaching almost a 1-year mark, it comes time for people to get their annual testing and things that help us benchmark their health. And so that's a bit of a struggle as well, from the patient wanting to come in or not come in. And the other thing that we don't really talk about so much is the guests that come with the patient. So if I'm an adult and I'm competent, I'm able to go to my doctor's appointment fairly, by myself and able to fare well. My husband may not, because it's a different story, but some of our parents or grandparents, they may need a support person there to really help that doctor in that conversation and help get some of the diagnostic things. And there are patients who are reluctant to give information or say what it is, because they don't know what the consequences might be for that comment that they make, or what testing might result from that comment. So even in this environment where we are bringing patients in and following protocols, we're finding that not having that support person there can also be problematic and can really limit the doctor's diagnostic ability.
I agree. It's a really very good point you bring up. Since my retirement, my wife and I have gone to every doctor's appointment, whether it's for me or for her. And this is strange to us. It's scary. We need a second pair of ears. Everybody needs a second pair of ears, but as you get older, you really need a second pair of ears. And this is not allowed. And you have to sort of go it on your own. Very good point. Okay.
Yeah, we rely a lot on, okay, we'll call your husband or we'll call your wife when we finish the conversation. The doctor will fill them in, but you still lose a lot of that back and forth and a lot of even compliance with the treatment plan. when you don't have that person there in the room.
Right, right.
Yeah, that's really interesting. I didn't really think about the fact about bringing the guest in and how important that is. Like my parents, for years would go in with me and say something and that I wouldn't even think to mention and would end up being important. So yeah,
Right.
and I definitely have I actually used telemedicine before all of this, being in college, because I was always kind of scared to go into like the healthcare places like by myself since I was away at college. So I definitely have used it before all this, and it's a really great tool, especially for things that aren't, urgent right now. If you don't need to be going in, and you just have like a quick question. So I think that telemedicine is definitely really helpful. But a follow-up question for the last one is, how do you think, people really not going in person and, being scared to subject themselves to tests and all that stuff, how do you think that will impact the healthcare system for the next 5 years?
Yeah, so I think it's made our providers think a lot more critically about some of the diagnostic testing that they've ordered and getting the patient to come in for that test. We hear a lot now of, is that necessary, or how important is it, how urgent is it that I get that test? And I think it will actually help in some regards with this kind of malpractice medicine that we've had, this defensive medicine that we've had over the last couple of years, where everybody's almost over ordering in some capacity to protect themselves from a provider perspective. And I think it's allowed our patients to kind of empower themselves more to say, okay, you're ordering this test. Why do I need this test? And on a scale of 1 to 10, how urgent is it for me to get this test now? And so it might impact, healthcare as a business. It might impact the business perspective of it from a financial standpoint, but from a diagnostic standpoint, I think it's really allowed everyone to think more critically about the tests that you need and how you're going to be bringing those patients in, or how to use other tests that may be quicker or less exposure, and be able to diagnose things differently and really think creatively at the end of the day.
And I totally agree. As I said earlier, the thing that I'm most concerned about is that I think that because there is a fear, an underlying fear of patients, by patients. There's been a lot of discussion, are women getting a mammogram? Are they putting it off? People not getting DEXA scans, things
Yeah, absolutely.
that colonoscopies, that's a big one. People are fearful about being put out and having that done now.
Right. I mean,
the long run, I think it's
concern.
going to impact, as I said earlier, that unfortunately are going to be people who are sicker than they could have been or would have been if they had been proactive as we did before we had COVID.
Mm-hmm. I agree.
And Christina, you touched on this a little bit about, discussing with the patient, how urgent it is that they get certain tests, but how are providers, other than that, going to get patients to come in if the telemedicine just isn't working diagnostically? Like, how do you kind of convince them to come in? And because what if COVID continues for another 6 months? Like, how do you think that the offices will adapt to that?
Yeah, so I think we utilize a lot of data. So you've even seen in these curves, right? We've had a wave, and so when we're at the peak of these waves, or hopefully at the peak of these waves, we're kind of stepping back and saying, okay, let's limit the capacity of let's set lower limits for our capacities. Let's up our cleaning protocols and things like that. And then when we dip down, really being able to say, okay, let's expand what we're able to bring in, and let's make a bigger push for the patients to come in and get that diagnostic testing, or even get an actual physical exam. So instead of saying your 4-month appointments, a telehealth, the doctor will say, all right, and then for your follow-up appointment to this, I'd like to see you in the office. And then even balancing out your types of patients. Maybe if you're an established patient and it's a well baby check, right? We're just checking in on you. Maybe those can be deferred to telehealth for a period of time, versus our new patient appointments, maybe saying, okay, we want to be able to do a full diagnostic workup because of the concerns you've brought. And a lot of times it may end up being you start with a telehealth appointment, and if there are concerns that need to be brought up, we say, all right, we're gonna see you in the office, and really re-stressing to the patient what our protocols are and how we're taking all of those safety measures, which in patient world and even in the real world, right, it's received one way or the other depending on the person, and really taking advantage of the downward swoops where everybody feels a little bit safer and they're feeling a little bit less cautious maybe, and more open to being able to come into public spaces. It certainly helps to watch those trends that way.
Yeah, that makes sense. I think, yeah, it's just, having that honest conversation between the patient and the provider, and both, the provider validating that the patient feels nervous and the patient being honest with their fears. I think that it just needs to be a transparent, honest conversation.
Absolutely. The more transparent you can be with a patient, and the more honest and open you are about any of these types of things, we've always gotten better feedback from patients, and you truthfully get a better conversation with the patient, and the patient's able to open up more. If you're more transparent and honest about where you're coming from a provider perspective, the patient's going to give you more information, and open up more, which allows you to give a better diagnosis as well, and treatment plan.
I think there's like a little bit of like a fear or something of, admitting that you're scared, or especially right now, to say that you are afraid of all these things, but it's completely valid, and it is something that should be easily discussed. So that's important. Okay, finally, because of the changes in the patient experience over the past year, do you think that the typical visit that we remembered before the pandemic will return once a vaccine is available and folks feel safer? Or do you think that it'll be different than what we remember?
Well, I think that, as I said earlier, that telemedicine is also now going to become a very common thing. People are getting used to it, they're accepting it, and it's going to be an option. And I wouldn't be surprised that once this is all over and everyone is hopefully vaccinated and we're able to talk to each other and hug each other and take hands with each other, when the doctor has that annual visit or that 6-month visit, he or she may say, the next one we'll talk and you don't have to come in the office. I think it's going to and I'll let Christina touch on this, but I think it's going to tremendously impact scheduling. One of my biggest pet peeves with doctors has always been that they think they must triple or quadruple schedule. Like there's about 7 patients in the time slot that I'm supposed to come see the doctor. They've had to not do that anymore. Obviously, they got to slow down their scheduling. From a patient's perspective, it would be refreshing to be able to show up to an appointment at 8:30 and see the doctor by 8:45 and not be there in the office in the waiting room until 9:30. So I think that after all is said and done and we're back to normal, or whatever normal will be, that may change. And I think that we're going to see maybe a little bit more caution in terms of how people conduct themselves. My greatest hope is after all this is done that people don't get sloppy again, because we've been shown as a world population how devastating an epidemic can be, a pandemic can be. And hopefully people will not forget this, that if you have a cold, simple cold, that you'll do something proactive so that other people don't get colds and that we don't have a flu epidemic. So I hope it sets a precedent for our proactivity, being proactive in terms of being concerned about ourselves and certainly about our fellow man in terms of protecting them from getting sick too.
I agree. So telemedicine, in my opinion, is not going anywhere, and it certainly has its benefits. And I think that we hopefully as a population aren't too quick to forget these lessons that we've learned over the course of the last year. And, you know, as from a provider perspective, as we're screening all of these patients that are coming in, my first thought was, I'm asking patients, have you had any nausea, cold symptoms over the course of the last 2 weeks? Fast forward to a year from now when hopefully there's a vaccine, please don't come in if you have a cold or, you know, for a well visit. That seems like something we should be all adapting as a policy for just being courteous to our fellow humans and being courteous to the provider and the person you're, you know, going to be in the exam room before or after. I also hope that and anticipate that we'll keep a lot of these cleaning protocols, because, you know, when I go into an office now, I think, well, we should have, you know, we were doing all of these cleaning things before, but it's almost like we're bragging about it now. We're being really outward about it. Like, look at us, we're wiping all these surfaces down, and we have got people trolling the hallways to wipe down light switches and doorknobs, and
Or washing our hands more.
Washing our hands. I mean, you know, back in the beginning of the pandemic, when we were like, wash your hands, it seemed like such an easy thing, but I can tell you my hands are more chapped now than they were last winter with all the hand washing and things like that. But really making an effort to make sure that we're still bragging about this hygiene, and we're still making a big effort to wash our hands and do that in front of the patient too. And maybe before you were gelling in and gelling out of the patient, but really making it almost a spectacle to say, like, look, we're taking your health seriously, you take our health serious as well. And again, just making sure that we anticipate these things and offer that option for telehealth. If you maybe aren't feeling well and it's something that can be handled via telehealth, great, let's utilize that option. Video can take you so far as, you know, to see the patient. The only thing you're missing is really that sense of touch and maybe being able to listen through a stethoscope or something like that, but there's still audible ways to balance this out. You know, I have 2 young children. If I have to take my child in for a rash appointment to the pediatrician in the future, I don't know how I will do that. It's just been so easy to be able to get on a quick call and be able to get that diagnosis that you need, get the treatment plan that you need, get the cream ordered to the pharmacy, and that convenience, I don't believe, will go away, because there is a convenience factor to this as well.
Yeah, definitely. Thank you both so much for this conversation. It was really interesting to, you know, get both of perspectives of the patient and the provider, and I feel like I really learned a lot, and I'm going to be thinking about that when I go into the healthcare offices in the future. But yeah, thank you guys so much for.
Thank you for having me. It was nice to speak to you both.
Thanks.